later if you're interested. I don't blame you if you're not interested. Once is, even if it's a great lecture, once is enough. Okay, but before we get into the adductors, which will kind of round out, no pun intended, our entire femoral compartments, the thigh, I would like to do a little bit of review because I want to make sure that we haven't forgotten all muscles. We're going to start with Miss Flores because Miss Flores said I was a pain in her glutes. So, Miss Flores, what are your three gluteal muscles? What are their names?
Sir, teacher, I don't know. Give me like a minute so I can go get my paper.
No, start talking to me right now. You're in class. Dígame.
Hold on.
So, you have a big glute, a medium glute, and a little glute. What do you think we call the big glute?
Maximus,
Gluteus?
the minimus, and the medius.
Okay, can you say gluteus in front of those?
Gluteus maximus, gluteus minimus, and gluteus media.
That was perfect. Thank you, ma'am. Okay, one other thing. They kind of wrap around my hips, my glutes do. Which glute is most posterior? Which one is furthest back that I have my hands on right now?
I didn't even listen to the question, teacher. Can you repeat that?
Whoa. It's going to be a day like that, huh, Miss Flores? Okay, all right.
No, teacher.
Miss Flores, which one is most... My glutes kind of work around my hips. They're not just in one place. Which of those three glutes that you told me, which one is most posterior, most in back?
Most in back? Is it the... don't tell me that answer.
Grab way behind you and tell me if you're feeling something big or little back there.
Most in back.
Yeah, reach behind you and grab your backside. Tell me if it feels like a tiny little muscle or a big muscle.
Is it the maximus?
Yes.
Medius?
No, don't start guessing. It's gluteus maximus. Gluteus maximus. As I move forward, I'm kind of lateral here. I'm on the sides. What glute is that?
The minimus?
How about the medius?
The medius?
Yeah, and as I go a tiny bit forward, what's that last glute?
The minimus?
Minimus. Yeah, and I'm making a big deal out of this. So it goes max, med, min. It works around from back to front.
Max, mid, min.
Yeah, okay. Med, min. Gluteus maximus, gluteus medius, gluteus minimus. Now the minimus isn't right in front of everybody, but the medius and minimus make your hips on the side. Your gluteus maximus makes your buns. But what's important about this is I can now tell you actions because of where they are. If my gluteus maximus is in back and it pulls my hip back, what do we call that? What do we call that when the hip goes back?
I forgot.
Well, it's either an adduction, abduction, elevation, depression, protraction, retraction, flexion, or extension.
Those are too many options.
Okay. Can we narrow down some of those options? No?
Is it, I don't know, teacher.
Flexions and extensions usually move you front and back. So it's probably either a flexion or extension because abductions and adductions move you to the side. This is moving to the back. So it's either a flexion or extension.
It's flexion?
Well, you had a 50-50 chance. It's an extension, yeah. We extend behind us. We tend to flex in front. We tend to flex in front. Flex F, front F. So an extension. Okay. So the gluteus maximus does a powerful extension of your leg. It actually pulls my leg down to get me out of a squat, usually. The gluteus medius is on the side, so it can pull me to the side. What do you call that when my leg goes away?
Flexion?
You're killing me. Flexions and extensions that go frontwards and backwards. Things that go out to the side are either abductions or adductions. So am I adding it back to my body or am I taking it away from my body?
You're taking it away from the body?
Yes. So is it an abduction or an adduction?
Abduction?
Yes, because add would be adding it back. Abduction, good. Now, save that answer that you keep using, because in front, the gluteus minimus is in front. It can actually help me pull my hip up towards the front. What do we call that? When I bend.
Abduction?
Flexions and extensions tend to go frontwards and backwards. Abductions and adductions tend to go to the side. Flexions and extensions tend to go in front. They have to say this way. So it's either a flexion or extension. What letter does flexion start with?
F.
And what letter does front start with?
E. Front starts with
Front.
F.
Yes. What guess would you like to give me for what it is, if it's happening in front?
Flexion?
Yes. So, my gluteus minimus gives me a flexion in front, my gluteus maximus gives me a extension behind, and my gluteus medius goes out the side, abduction. I am oversimplifying everybody a tiny bit. There are some arguments you can make about different fibers and things like that. But it is true what I've said, at least. Thank you, ma'am.
Thank you, sir.
I'll come back to you.
I look forward to it.
Good. I like that. Okay. Miss Ramirez.
Hi.
Hi. I know you have a tummy ache, but what are your 3 gluteal muscles?
Gluteus maximus, gluteus medius, and gluteus minimus.
Good. Which one is most posterior? Which one is most behind you?
Gluteus medius?
I don't mean this in a weird way, but reach behind you.
Yeah, I'm trying to.
Does that feel like a big muscle or a small muscle behind you?
Well,
Does your butt, I don't mean this like in a negative way, but does your butt
look,
feel
I
like
don't have one, so.
Everybody's got a butt. I hear what you're saying.
The gluteus maximus.
Yes, thank you.
Yeah.
I love that. Gluteus maximus, thank you. Then we go to the side. What's that?
Like the side?
Kind of the side, yeah.
Minimus?
What's the other one?
No, medius.
Medius. And then kind of a little bit in front is the gluteus
minimus.
Yes. Guys, think big, medium, little. It's going in order. Big, medium, little. Cool. All right, so when I say them to help myself remember that, I grab my buns, which is strange, but I do, and I say gluteus maximus. I grab my hips, say gluteus medius. I kind of go in front a tiny bit and say gluteus minimus. So what are the 3 gluteal muscles in order from back to front?
Back to front is gluteus maximus, gluteus medius, and gluteus minimus.
You are doing excellent. Thank you, madam. I do have to ask you about the actions of them.
Okay.
Actions. So, the gluteus maximus is in back, so it pulls in back. What do we call that when we bend in back?
Extend.
Yes! It's an extension. The gluteus medius is on the side, so it pulls out to the side. What do we call that? When it pulls away from the body.
Abduction?
A what?
Abduction?
Yeah, abduction. AB is in boy. Yeah, abduction. Cool. And then the gluteus minimus is in front, and it can pull me in front. What do we call that when my leg goes in front?
Flexion?
Yes. Awesome. Thank you, ma'am. Really good. Really good.
Thank you.
Let's see here. Miss Kilpatrick. Madam. Miss Kilpatrick, what are the 3 gluteal muscles?
The maximus, minimus, and medius.
Sorry. Gluteus.
Maximum.
But you say gluteus too.
Huh?
I'm just trying to get you to say gluteus also for practice.
Gluteus maximus, gluteus minimus, and gluteus Again, medius.
Yeah,
Medius.
yeah. I wouldn't say them in that order, but you did tell me all three, and that's correct. So which one is most posterior? Which one is most behind you? Which one makes your butt?
The gluteus maximus.
Yeah, it's big, max. Awesome. Which one kind of makes my hips a little bit in front? I mean, a little bit on the side.
The gluteus minimus.
That one's in front. Remember, it goes medius. Yes, it goes large, medium, small. And which one is a tiny bit in front?
The medius.
Which one?
The small.
Yes. And can you say the whole word for it?
The gluteus minimus.
Yeah, good job. Okay, so, awesome. So the gluteus maximus pulls my leg back. What do you call that when your hip goes back like that?
Extension.
Yes, ma'am. That's exactly correct. Thank you. The gluteus medius is on the side. It pulls my leg out to the side. What do we call stuff that goes out to the side, goes away?
AB.
Yes.
AB.
AB. AB is abduction. Yeah. Abduction. I like it. And the gluteus minimus pulls me in front.
Flexion.
Yes. Thank you. Well done. Really well done. Thank you. That's exactly what I want. Awesome. Okay. Mr. McClure.
Hey, buddy.
I'm talking about the three gluteal muscles, just for review. What are the three gluteal muscles from posterior to anterior?
Gluteus maximus, gluteus medius, and gluteus minimus.
Yes, sir. Now, I've been talking about flexions and extensions with these and abductions, and that's 100% true. But that's if it moves the leg. If the leg is stable, these muscles could actually move the hips. And
Dancing to some reggae.
what?
Dancing to some reggae.
Yeah, that's right. You could use these to dance to some reggae. I like that. But it could also create certain types of tilts of the pelvis. Which one of these muscles could create, working bilaterally, both sides, it doesn't have to be, but it would help, could create an anterior tilt of the pelvis?
The minimus. Gluteus minimus.
He's right, everybody. Gluteus minimus can bend me over, which is an anterior tilt. Bending me over is the same as lifting my leg up. I know it doesn't seem like it, but I am coming to that leg. My body doesn't know the difference. I'm still bent here. So if somebody had an anterior tilt of the pelvis, the gluteus minimus is one of the many muscles you might look at. Which one could actually probably cause a posterior tilt?
Gluteus maximus.
He's right, everybody, because pulling my leg back is the same as tipping my hip back towards it. I am bending backwards, and so tight glutes, tight gluteus maximus, could cause a posterior tilt. Nice way to apply your anatomy. Sir, which one working unilaterally, just one side, could cause what we call a lateral tilt or a lateral elevation? It means your hip, one side goes up or one side tilts. Which one?
Gluteus medius.
Gluteus medius. All right. For $1 million, he's 100% right, by the way. That's the side one. Closing. If the gluteus medius is tight on my left side, which side of the hip goes up?
Your right side.
He's right. He's exactly right, everybody. What happens is that gluteus medius pulls me like this, and it causes the right side to go up. So you actually see somebody kind of like this, elevated here. The tightness is probably over here. This side actually had to loosen up to have that happen. Now, there are other muscles involved in this, but we're just trying to show you how to apply anatomy. Well done, sir. Thank you. Just trying to emblex it up for you a little bit there. You know? Yeah. Cool, cool, cool. All right. Mr. Kachekian. Yes, sir.
When you said the one hip pulls up and the other one stays put, is that because the other one can't actually move as much because it's tighter? Is that the reason?
I'm confused. I don't mean like I'm not making fun of you. I meant like I'm confused about the question. So, what happened, I'm trying to think if I could show you. I don't know if this helps, but what happens is there's a leg here that goes into this thing, right like that. This is kind of big for a femur, believe it or not, but it would go right here. Go right here. The gluteus medius is right here, and if it tightens up, what it does is it pulls the hip to this leg over here. And that raises this hip. Believe it or not, this muscle actually has to stretch out over here. Because if it tightened up too, it would stabilize you. And on some people it does. Some people are tight on both hips. In fact, most people are. Because the body is trying to straighten you back up. It's aware. Your body doesn't like walking around like this. So I don't know.
So it's actually pulling it down this way.
Yes. So what's happening is the gluteus medius
that was what I was trying to get at, sorry.
Sorry. Well, I should explain better. You're right. The right hip isn't really going up as much as the left side is going down. You're right. It's pulling it down. Well said.
Okay. Just
And the right
clarify,
hip's
thank you.
forced up. Yeah. Yeah. Interesting. And lateral tilts are a bear, everybody, because lateral tilts start to cause scoliosis. Right? Your spine is supposed to be straight when you look at it head on. From the side, it's got this beautiful S-curve, right? Or it should. And we want that to be not too exaggerated, not non-existent. But from the front, it should be straight. And if I start to tilt my hips, all of a sudden, my spine has to wiggle out to the sides to straighten that out. So what it's trying to do is get my head back over my hips. Because you really can't do some stuff if you don't do that. If I don't get my head over here, I will fall over. I mean, it can't be done. You have to put an arm out or something. Because that's your body, it tries to kind of pull you back into posture. Ms. Tops, yes ma'am.
So is it safe to say that one muscle is shortened and one muscle is lengthened?
Yes.
Okay.
And I actually appreciate you putting it that way because that's the way a test would put it. And that was not a leading question. I don't know if that's the way I'd put it on a test, but as a very common physical therapy, sports therapy, massage therapy test question is which muscle is lengthened and which muscle is shortened. And yes, we would say in this case, the left hip, left gluteus medius is shortened and it's pulling that hip down. The right gluteus medius is actually lengthened and allowing it to come up. And as massage therapists, we would rub the left side to try to loosen it up. Physical therapists would try to strengthen the right side to pull it down. That's why physical therapists and massage therapists work so well together. One tries to strengthen the muscle that could possibly be weak to help compensate for this other one. The massage therapist tries to loosen up the muscle that's pulling when it shouldn't. Yeah. Ms. Smith, I saw you thinking there. I watched, you have this neat, inquisitive look on your face. Yeah.
Question about, just because you brought up physical therapy, sometimes I feel like there's a lot of gray area between massage therapists and physical therapists. So what is in their scope that we don't do, I guess.
You mean what can we do that they can't? Is what you really mean, maybe?
Yeah, kind of what's the real difference? I understand that they don't sit down and do hour massages. They're more strengthening. But as a massage therapist, I feel like I would be recommending the strengthening of what they would be recommending.
Right. Yeah.
So I don't know. I get a little confused.
You're not the only one, by the way.
Differences.
And this won't completely solve your confusion because there's some legal ambiguity. We've talked about this on the massage board before. There are some things that it's actually not. There is not a clear case and it hasn't been challenged in court. Basically, physical therapists can do everything you guys can do, and you can't do everything they can do. They go to much more schooling than we do. It's much more intense schooling, too, to their credit. If you find some of this stuff challenging that I just did here in class, you would find physical therapy much more challenging. So I'm getting towards your question. It's a complex question. So what is interesting, though, is occasionally physical therapists go to massage therapy school for two reasons. Physical therapy assistants, which is a little less schooling than physical therapy and still makes pretty good money, so a lot of people do it. I have students leave this class and go become physical therapy assistants. But they they can't work on somebody without a supervisor in the room. So a physical therapy assistant has to have a physical therapist there to even massage somebody. And sometimes they'll go to massage school to loophole around that rule, because now all of a sudden they can work on somebody without, you guys don't need a supervisor present, right? And so it kind of allows them to kind of sneak around that. Sometimes they'll do it for that reason. The other thing is physical therapists will tell you, they'll be like, yeah, my muscular anatomy is amazing, but we covered very little massage in school. So they're legally allowed to massage. They're not terribly good at it usually. And we see that when we partner with them before. So they could be, but so sometimes they come because they really want to learn massage therapy. So for that reason. When it comes, but I'm going to head back to what Ms. Smith was saying, because I've done the same thing, Ms. Smith. There is a little bit of gray area. Technically, we're not supposed to prescribe exercises and things like that, and yet there's not really a law exactly against it. So what would really happen more is the physical therapy board would get upset we were doing it maybe, and you still wouldn't get in trouble. They would just try to make it a law or something. So you're absolutely right. I don't think you could lead them through the exercises, right? But you sure could recommend them. Yeah.
Okay.
Do avoid things like recommending nutritional stuff, though, which I know is not your question, but somebody will get you on that. They'll be like, you're not a nutritionist. You can't recommend a diet. You can, though, by the way, get around all this stuff completely legally by being like, I don't know what you should do, but here's what I do, and it really worked for me. I don't know what you should eat, but I eat grape nuts every morning. It really worked for me. Like, whatever it is. You can do that quite legitimately, and you probably never get in trouble. And so you can recommend strengthening exercises. It's a gray area, but I feel it's a completely safe gray area. There's one other little tricky thing you guys can all do. You know, when we've done P&F stretching, you can have people resist you on the side that's loose, that's as Ms. Tops put, that's lengthened. And you can be doing it. It's physical therapy you're doing. You're strengthening that muscle, right? But it really looks like P&F stretching, and it kind of is, but it's building up strength in that area. And that's very helpful, and in a way you're doing physical therapy without machines and such.
Okay.
Right.
Same kind of with so if I wanted to get my personal training certification, like after massage therapy school, I know you're not a physical therapist, but that's like giving you your certification to strengthen.
Yeah.
Right?
I used to be a personal trainer and a massage therapist together. It worked really well.
Right.
And I did what you're talking about doing. Plus also, I mean, it's kind of a joke, but it was true. You know, you make your clients sore and then you offer them a massage and then you get them to work out again. It works really well. Yes, you could do that. You could probably completely legally say, yeah, you know, you might do well with some strengthening exercises if you want to, you know, start it's not a physical therapy session, but if you want to kind of get yourself back on recovery, I could show you some stuff to work on your core strength in general kind of stuff. Yeah.
Right. Okay.
Yeah.
So there is a lot of gray area between.
There's a lot of gray area.
All three.
Yes.
Okay.
Yeah. And I would actually, I hate to say it, I'd be very careful about the way you phrase stuff is all. But yes, with a personal training license and a massage therapy license, you could do a lot. You couldn't work in a physical therapy area, but you couldn't tell people, let's go do physical therapy, but you could say, hey, I've loosened up the muscles that are causing you problems, but you've got some weaknesses here. And, you know, in the gym, if you want to set up a session, we could, you know, put you on a training routine that would help with your core strength. Yeah. It's a very good idea. I like the idea. All right. Any other questions? Mr. Kachekian. Yes, sir.
In addition to what Ms. Smith is saying, have you ever recommended something and got pushback from like other therapists that were working with that client that say, "Oh, why did you tell them to do this?" and it's damaging something, or it's not healthy for them to do, or something like that?
It's a really good question, by the way.
Sorry if I worded it weird.
No, you didn't at all. Very rarely. For one thing, most clients are only seeing one therapist, massage therapist. I did once work with a Rolfer. Rolfers go to extra schooling and things like that, and they tend to be very, well, they think their Rolfing is amazing. Rolfing is amazing, by the way, but they tend to be very protective of it. And the Rolfer wanted me to work on very clear things not to mess up their Rolfing. But I worked for them. So that's like my boss telling me to do it this way. But no, in general, you don't have other therapists chiming in because you're the only therapist working on the person. Yeah. And the nice thing in massage is you can waste the client's time, but in general, it's hard to, like, you might not get anything done, but in general, it's hard to make things worse. Usually. I mean, not majorly. Unless you truly damage them or something. But in general, you're not going to make things worse. You're just not going to make them better. Yeah. All right, everybody, let's take a 10-minute break here. Come back at 9:06. 9:06. Quick review of the gluteals that we just talked about. Just to make sure everybody's paying attention, then we will talk about new muscles, the adductors, that also have to do with hip alignment and are super cool once you really understand where they're at. Mr. Bigelow, sir, what are the 3 gluteal muscles from posterior to anterior?
Mr. Tapscott,
Yes.
thank you so much for being such a patient instructor. Patience is a virtue, and I appreciate it. Having said that, gluteal muscles, gluteus maximus, medius, and minimus.
Oh, I thought you were going to be like, you're so patient, and I don't know. Awesome. One more question, sir. Which one of those would be most responsible for a flexion of the hip or an anterior tilt of the hip?
Minimus.
Minimus.
Gluteus minimus.
Because it's in front and flexions happen in front. Thank you very much, sir.
Yeah.
Miss Cafiso. Miss Cafiso, what are the 3 gluteal muscles? From
Gluteus maximus,
from posterior to anterior.
gluteus maximus, gluteus medius, gluteus minimus.
Awesome. Which one of those would be most responsible for a powerful extension of the hip?
The gluteus maximus.
Yes. Yeah. Exactly. Extensions happening behind you, and also I said powerful, which is a little extra clue. But yes, well done. Thank you.
Thank you.
Miss Dowler, what are the 3 gluteal muscles from anterior to posterior? Flipped it on you.
Gluteus minimus, gluteus medius, gluteus maximus.
Yes. Which one of those is the largest?
The gluteus maximus.
Yeah. Which one's the smallest?
The gluteus minimus.
Yeah. Which one's found most laterally?
The gluteus medius.
I think you said it. You cut out. What was that one?
The gluteus medius.
Yes. Thank you, ma'am. Miss Tops.
Yes.
What is the capital of? No, I'm kidding. What are the 3? What are the 3 gluteal muscles from posterior to anterior?
The gastrocnemius, the soleus. No, I'm playing.
You know what? I'm so used to that pattern too. I was like, no. Okay.
The gluteus maximus, the gluteus medius, and the gluteus minimus.
It's one in every group. Yeah. Which one of those would be most responsible for? I mean, or could be responsible for a lateral tilt or an elevation of the hip on one side?
That will be the gluteus medius. No, the gluteus, medius.
Medius, that's exactly correct. Awesome. And just since you seem to know other muscles too, what are the 3 calf muscles?
The gastrocnemius, the soleus, and the plantaris.
Good. What are the 3 hamstrings?
Hamstrings is the bicep femoris, the semitendinosus, and the semimembranosus.
Good. What are the 4 quadricep muscles that are in the anterior lateral compartment of my thigh?
The quad.
They're very vast. They're massive.
The vastus intermedius, the vastus lateralis, the vastus medialis, and the rectus femoris.
Awesome. Do you know the 5 hip adductors?
Okay.
Hey! That's it. Now we're going to do them all. Do you know the? You're doing great. Do you know the 5 hip adductors we're going to do today? 3 have the word.
Okay, the abductor brevis, abductor longus, abductor magnus, the gracialis, the gracialis, no.
Gracilis.
Yes, you told me. I wanted to say it. The gracilis and the pectineus or something.
Can I say it?
Yeah, you can say
Okay. Pectineus.
Patina.
She's got me trained. Thank you so much. That was very clever too. See what you did there? And we're done. Thank you, Mr. Tapscott. Okay. Mr. Nochin. What are the 3 gluteal muscles from posterior to anterior?
Posterior to anterior.
Yeah.
Gluteus maximus, medius, and minimus.
Cool, sir. Which one of those is responsible for an abduction of the hip?
Abduction of the hip.
Yeah. Out to the side.
The minimus.
Is that your final answer?
Yes.
It's wrong. So the medius is on your side, so it would do an abduction to your side. So because the one in back tends to pull you to the back, the one on the side tends to pull you to the side, and the one in front tends to pull you in front. So max, med, min. So which gluteal muscle is most posterior? I think you know this because you said it.
Most posterior.
Yeah.
The maximus.
Good. Which gluteal muscle is responsible for an extension of the leg behind you?
The maximus.
Yes. Which gluteal muscle is most lateral, kind of on the sides?
The medius.
Yes, gluteus medius. And which gluteal muscle is most responsible for an abduction of the hip out to the side?
Medius.
Yes. And which gluteal muscle out of the 3 gluteal muscles is most anterior? Front.
The minimus.
Yes. And which gluteal muscle is most responsible for a flexion in front of the hip?
The minimus.
Thank you, sir. By the way, I was doing that for everybody, sir, just so you guys know. I'm running through everything. Thank you.
Yeah.
Miss, I feel like I already called her, too. Miss Mitchell.
Yeah.
Miss Mitchell, what are the 3 gluteal muscles?
Do you want from posterior to anterior?
I do. I apologize. Thank you for asking.
Gluteus maximus, gluteus medius, and gluteus minimus.
Good. Which one of those can be responsible for a posterior tilt of my hip?
Gluteus maximus.
Yeah. The one that's most in back could pull me to the back. Posterior means back. Wow, very cool. Which one could be most responsible for an anterior tilt of my hip?
Gluteus minimus.
Yeah, and which one could be responsible for a lateral tilt or a lateral elevation of my hip?
Gluteus medius.
Yes, thank you, thank you, thank you. Well done. Miss Langford. Miss Langford, oh, you're so muted. Miss Langford, what are the 3 gluteal muscles?
The gluteus maximus, the gluteus medius, and the minimus.
Good. Which one's the biggest?
The maximus.
Good. Which one's the smallest?
The minimus.
Good. That's enough. Thank you. Miss Stewart. From posterior to anterior, from big to little. Posterior to anterior and big to little. What are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, gluteus minimus.
Thank you, ma'am. Miss Vega, what are the 3 gluteal muscles from posterior to anterior, from biggest to littlest?
Gluteus maximus, gluteus medius.
Thank you. Miss Lewick, what are the 3 gluteal muscles from posterior to anterior, from biggest to littlest?
Gluteus maximus, gluteus medius, gluteus minimus.
Thank you, ma'am. Mr. Ashokali, what are the 3 gluteal muscles from biggest to littlest, from posterior to anterior?
Gluteus maximus, gluteus medius, gluteus minimus.
Beautiful. Thank you, sir. Miss Cuppage, what are the 3 gluteal muscles from posterior to anterior, from biggest to littlest?
Gluteus maximus, gluteus minimus, medius, and gluteus minimus.
Thank you, ma'am. Miss Juntapone, what are the 3 gluteal muscles from biggest to littlest, from back to front?
Gluteus maximus, gluteus medius, gluteus minimus.
Beautiful. Great, thank you. Mr. Kachekian, what are the 3 gluteal muscles in the order that I like to memorize them, because it helps me figure out all sorts of other stuff, and I keep running it to the ground for everybody so they'll never ever forget?
Gluteus maximus, gluteus minimus, gluteus maximus, gluteus medius, gluteus minimus. I don't know why I did that.
That's all right. You caught yourself. That's all I care about. Thank you, sir. Miss Lopez Moreno.
Hello.
Hello. What are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, gluteus minimus.
Cool. Thank you. Mr. Penrod. What are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, gluteus minimus.
Thank you. Miss Magruder. What are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, and gluteus minimus.
Yes. Can you say it one more time so I hear the medius part?
Gluteus maximus, gluteus minimus,
Medius.
gluteus. Oh, medius.
Yeah.
Oh.
And then
Gluteus medius and
that-
minimus. Gluteus minimus.
I think you made 4 now. So we have maximus, medius,
Maximus.
like middle or medium, and
Yeah.
minimus.
Minimus.
So let's do it one more time.
Yeah. Okay.
Gluteus maximus,
Maximus, gluteus minimus,
medius, medius.
mediumus,
No,
right?
medius.
Medius. Okay.
And then minimus.
Gluteus minimus.
Good. We'll take it. Thank you, ma'am.
Hi.
Miss Ratana.
Since I have an appointment tomorrow and I have a glucose monitor that
So,
is attached to my
Miss
stomach.
Sewik has an appointment tomorrow. So, there you go. Okay. Miss Ratana. Where are you?
Yes.
What are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, and gluteus minimus.
That was beautiful. Thank you. Miss Smith.
Mr. Grascott.
Miss Smith. What gluteal muscle do I use to bend my hip in front, to do a flexion in front, to bend over in front?
The gastrus minimus.
Gastrus minimus. Hey, buddy, you can take those 3 and leave whatever you got. That's it. We're good. Thank you. How about gluteus?
Gluteus, sorry.
You made a muscle with a calf muscle. Yeah.
And oh my goodness.
Yeah, it's okay.
Gluteus minimus.
It's Miss Thompson's fault because she threw out that joke. She thought she's all
It
funny,
is.
and then she threw off the whole class.
It is.
Yeah. Which gluteal muscle gives me a posterior tilt of the hip or an extension of the leg and back?
Your gluteus maximus. Now all I can think is gastro.
Yeah. And which gluteal muscle can cause me to bend over to the side?
Your gluteus medius.
Yeah. I love that. That's very good. What are the 3 calf muscles?
Gastric medius, soleus, and pectoralis.
Thank you, ma'am. Miss Tisket. Hi.
Yes.
What are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, and gluteus minimus.
Thank you. Thank you, everybody. Awesome. Thank you guys for your patience. I know that's annoying. I know all that stuff, but that's called studying. Like, that's the way it goes. And I'm literally trying to layer information that you will use for the rest of your life and kind of tie it into actions, and so you don't have to memorize them. You're just like, oh, the gluteus medius on the side of my hip, therefore I guess it can pull my hip out. Oh, that's an abduction. You know what I mean? And you can start to figure out all sorts of actually very cool stuff. You will be in a massage room one day. I promise you, promise you, promise you. And you'll probably call me afterwards and be like, oh my gosh, Tapscott, you were right. I just figured out this problem they were having with their hip because of this thing you told me. And oh my gosh. And you'll be like, I want to send you a gift. That usually happens too. Well, not that part. Okay. All right, let's talk about...
Plug.
Yeah, a little plug for you. Let's talk about... And by the way, it's hard to know just what to get me, so cash is best. You know, let me decide, right? Okay. Let's talk about the hip adductors. So they literally, the word add means to put together. You know, these muscles pull your legs back together, right? They are found, therefore, where? In what part of my femoral compartment, anterior, posterior, medial, or lateral, would I find the hip adductors? Anyone raise your hand. I like that. Miss Cuppage raised her hand the old-fashioned way. Miss Wick, I liked it though. Miss Wick.
Medial.
Yes, because they have to be between my legs to pull my legs back into my body. Now, I know that we don't think we go around doing jumping jacks all day long, right? But you have to understand that you guys use these muscles for other things. It is oversimplifying to say that they just adduct, and we're going to talk about that today. Plus, the hardest thing that you will do with your lower body is to come up out of a squat. I mean, or to jump, or to anything that's like that. The hardest thing you have to do with your lower body is to come up out of a squat. You ever been sitting on the toilet? You're like, oh my gosh, how old am I? It's hard to get up off it, right? Or when you go upstairs, things like that. Well, when you do those things, yes, the gluteus maximus is responsible for powerfully extending your leg to get you back up. But believe it or not, you pull your legs together as you come back up to get yourself to come back up. And if you didn't, by the way, just so you know, if your hip adductors didn't pull your legs back in, your knees would split out the side laterally and you'd die. Just want to put that in your head too. Just bust right over the tibia, just like that, the femur. You'd hear tendons ripping, ligaments ripping, blood go and you go, oh my gosh, why didn't my adductors help me? Ah, and that's it, you're dead. All right, but that doesn't happen because you've got these massively powerful hip adductors. And by the way, they make up the vast majority of the size of your legs. Most of us are like, oh my gosh, I need to lose weight because my legs rub together. But in a way, they should rub together. These muscles are you've got 5 hip adductors. You only got 4 quads, and you only got 3 hamstrings. But you got 5 hip adductors. They're very, very important. Now, before we talk about these muscles that live on the medial compartment of the thigh, we need to talk about the origin of these muscles. And the origin of these muscles is the hip. They hook up between your legs. They really do. This is why we like to drape people high and tight, so we can work up between their legs safely and comfortably and actually massage these muscles instead of thinking we're massaging them by rubbing the side of somebody's knee and missing this much of their inner leg. So, let's talk about that. This is a hip. Yeah? It's a hip. And when you were a little baby, looks like you got a big bone here. By the way, let's talk about the hip here, and I'll explain the little baby part in just a second. You've got this triangular bone back here, this nice big orange one, right? That's your sacrum. I often think your sacrum is part of your spine because your spine sits on it, but most anatomy books call this part of your hips because it attaches one side of your hips to the other. Yep, and all together, they make this bowl that you guys carry your intestines around in. I do too. And this is anybody remember what this joint is between the sacrum and the hip here? We normally feel it back here. Miss Zwick.
Sacroiliac joint.
Yeah, sacroiliac joint. Can you elaborate on why I might care about that joint? What's so special about that joint?
Because that one joint carries all the weight of your upper extremities.
Miss Zwick, you are on fire today. Literally everything from my upper body. This guy up here picks up a pencil here. That weight has to go down and transfer to my lower body. And where does it transfer through? By the way, it transfers through a whole bunch of tensegrity and fascia and muscles, otherwise you'd be doomed. But this is the one joint that connects your entire upper body to your entire lower body. Well said, thank you. Yeah. You guys ever had that ache that feels like it's kind of in your bone back here? That's probably this sacroiliac joint that massage therapists call SI joint. I just don't let you call it here in class because I want you to remember what the SI joint is before you learn to abbreviate it. But once you leave here, people never say sacroiliac again, they say SI. So, sacroiliac joint. Okay. They don't call it the sacral hip joint. And we're going to get to why here in a second. When you were a little baby, you had 3 different bones that came together right here, by the way, believe it or not. They actually fused together and made this hole, this cup here, that your femur hooks into. Anybody remember what this hole is, this cup is called?
Is it foramen?
Foramen? Oh, foramen is this hole. Foramen is this hole. You're right. I'm sorry. This cup, this socket for your hip. Or
Fossa?
fossa is good. I mean, it is true. It is a fossa, but it has a particular name.
Femoral fossa?
That is a great name.
Tubercle?
By the way, no, tubercles stick out. But femoral fossa, by the way, is a really good name. I would understand what you meant by saying that, even though, with all due respect, it's incorrect. But it is.
Gluteal.
It is
Gluteal
the
femoral
it is the
fossa.
tab where I hook my ass. That's how I remember it.
Acetabulum.
Acetabulum. This is your acetabulum. And they actually call your hip joint, or your coxal, or your femoral acetabular joint. Right? And by the way, my femur would be more like this. It'd be right in there. And it really is a ball and socket. There really is a socket here. There really is a ball in your femur, and it really hooks in here. This is your acetabulum. And I know the tab that I hook my ass is stupid, but it just helps me remember it. So that's my acetabular joint. These bones were 3 different bones when you were a baby, and they fused here and became your hip bone. What are the name of these 3 bones? Anybody, raise your hand.
Ilium.
Well, hold on. You gotta raise your hand, sir.
Oh, sorry.
Simon said, man. Simon said. Give me somebody else. Give me somebody else besides Mrs. Wick. She's on fire. She's gonna get it right. Take a risk. Say something wrong. Mr. Bigelow, yes, sir.
The ischium, ilium, and pubis?
Pubis, yeah. Where it's by your pubic region. That's where it got the name, yeah.
So is that right? The ischium, the ilium, and the pubis?
Yes.
Okay.
So this is super important, and all massage therapists should know the 3 bones that make up your hips. Because we don't name stuff. Your hips are so complicated that we don't name stuff like the hip tuberosity. We name it the tuberosity of that particular bone that it used to be. So we don't talk about the hip. We talk about the ilium. Wait, what are you doing? Oh gosh, it thinks the skeleton's head is okay. Don't you dare. All right. So we don't talk about this being the hip bone. We say this is the ilium or your iliac crest. Now you can all feel your iliac crest. It's your hip bones. It's your hip bones. Your hips, when you see hips on somebody, I used to be able to see my hips about 10 years ago. They were here. They're here somewhere. Those hip bones, that's your iliac crest. You guys are sitting right now. They call this the sits bone, which is kind of annoying because we've got a lot of stuff in your body that they abbreviate with sits. But this is your ischium. Your ischium is in your tuschium. When you sit on a hard chair and your butt gets kind of numb, that's because you're sitting on a bone, your ischium. And your pubic bone, you can feel your pubic bone. I'm not being weird here. It's above your reproductive organs. There's a bone there. You're hitting this. You're actually hitting the pubic symphysis of two bones coming together. So these were 3 bones. You had this thing called an ischium. It looks like this. It really looked like a C, and it came up here and went, and it made part of this acetabulum thing. You had another C thing that came up here that was the pubis. Oh, don't do that to me. Pubis right here. It made the other side here. And then you had the iliac crest that came down, the ilium. This is important because when we talk about stuff down here, Miss Tops was right. This is called the obturator foramen. It's a hole. But this hole was created because a C, the ischium, met another C, the pubis. And when those C's met, they created the obturator foramen. So they don't call these C's in your book. They call these 2-armed bones. And the word for arms is ramus. This is very important because when you're describing muscles hooking to stuff, this is your ischium, And this is the superior arm of the ischium and the inferior arm of the ischium. It meets the inferior arm of the pubis, and here's the superior arm of the pubis. Why is this important? Because I've got muscles that attach all along here in various spots. You've got 5 adductor muscles. They don't all hook onto like one little spot right here. Yeah? In fact, the way your adductors hook on is, for one thing, you've got the ischial tuberosity back here. Tuberosity just means bumps on an ischium. The ischial tuberosity is where 3 really important muscles hook onto on your backside. Do you guys remember what 3 important muscles hook onto the ischial tuberosity right back here? Just like this.
The gluteal muscles?
Not really.
No.
The gluteal muscles hook on over to the femur, the head of the femur. Back here in the back, you've got a group of 3 muscles.
Hamstrings.
Hamstrings. Yes. Yes. And what are the names of the hamstrings?
Biceps femoris, semimembranosus, semitendinosus.
Yes. They hook on the back. And by the way, part of what the hamstrings do, by the way, is when you're bent over, they help to pull you back up. So they too can be responsible for a posterior tilt of the pelvis. Well, right after the hamstrings, don't do it, camera. Right after the hamstrings, right here on the inferior arm of the ischium, you've got the adductor magnus. Then you've got things like adductor longus, brevis, gracilis, and pectineus all going up here. The magnus is actually very far back. It's right next to the hamstrings. This is actually very important for 2 reasons to a massage therapist. Let's see if I can make this camera. Hold on, let me try. Thank you. Good. All right. Okay. This is a gluteus maximus. You're looking at the back side of the left leg of somebody right now. These are the hamstrings. Right? Yeah. Who? Mr. Wick, yes, ma'am.
I didn't even touch my mouse. I don't know how that happened.
Oh,
so
okay.
I'm not raising my hand.
All right. Anyway. It's hard to see here, but this is a 2-headed muscle and this is a 2-headed muscle. And the reason you can't see the heads is because this is the biceps femoris and there's a short head underneath it. This is the semimembranosus and semitendinosus, and they're kind of combined so you can't see, but there are 4 muscles here. It just only looks like 2. And they're not that wide when you rub them here. But what's interesting is right here is the adductor magnus. So when you are rubbing the back of somebody's leg, even though the adductors are all in the middle, including the magnus, right, you rub the adductor magnus back here. And because the adductor magnus is so far back on the ramus of the bone, the ramus of the ischium, it's so far back here, it can act like a hamstring too. Because it's in back, it can help pull your leg in back. It also pulls your legs together, but because it's in back, it can pull your leg in back. So the 2 important things about this is, one is when you're rubbing the back of somebody's leg, you are probably hitting their vastus lateralis. You better be, actually. You don't have to separate them. And you're hitting probably their adductor magnus. If you want to just get their hamstrings, which sometimes you do, you can actually wiggle your hand back and forth like this and feel somebody's hamstrings just like I am with this person here. And by the way, sometimes their hamstrings get a little stuck together here and I'll drive an elbow through here. Carefully, slowly, judiciously, but I will. But you are rubbing adductor magnus, semimembranosus, semitendinosus, biceps femoris, and vastus lateralis all at once on the back side. I tell you this because when we're thinking about the adductors, we're now looking at the inside of somebody's leg. the inside of their left leg. This is very weird. The right leg's been removed. It goes adductor magnus, and the other adductors are stacked in front. They're all between the leg. They're all on the medial side. But adductor magnus is most in back. And that's why it also acts like a hamstring, and the other ones are stacked on top of it. You can rub them all from the middle of the leg. You can rub the adductor magnus from the back, and you can rub a lot of these from the front. And you can rub them all from the middle. But the adductor magnus is most in back. And by the way, some of these ones that are really far in front can have a little bit to do with pelvic tilt or flexion of the leg too. Again, not their main job. Their main job is to pull your legs together. But because they go around the arms of the ischium and the pubis around that circle, the ones that are more in front can pull you a little bit in front. The ones that are really in back can pull you a little bit in back. Miss Zwick.
I don't know how this keeps happening.
Oh,
I think it's a button on my keyboard.
it's okay.
That's like a shortcut.
It's all right. Okay. So that's the significance of this whole hip thing. And you really do want to know the hip bones. You really want to know that this is the ischium that you're sitting on, the hamstrings hook back here. I want you guys to massage till you run into this thing. Very few of you do, by the way, from my experience, but I'd like you to. It doesn't feel awkward. You're not running up over their butt and underneath the sheet. You're just running right into here where the hamstrings hook. I want you to realize that then down the ramus, the inferior ramus of this ischium, that the adductor magnus is attached, and then the other adductors are in front of it, moving more forward. I also want you to know another couple of highlights on here for other reasons that we have talked about before, but it sounds like we need to review. You have a bump in front of your hip here. Does anybody know what this bump is called? It is bump in front.
Iliac crest.
This is the iliac crest, so you are
Anterior.
anterior, superior,
Iliac crest.
iliac spine. Yeah, spine because it sticks out. You actually have an anterior inferior one here. So this one's really important because you can feel it on everybody, including yourself. This is that bump in front of your hip here. It's the bump you see on like swimsuit models that need to eat. So, and by the way, if you can see it on yourself, I don't mean you need to eat. I just meant like it protrudes on some people. But it's a really good kind of, like, it lets me know where my hands are on a human body, especially in a really important spot. It is also the bump, by the way, that your sartorius hooks onto, but that's another thing. Right under here is, by the way, where your rectus femoris hooks onto. In back, what do you suppose this bump is called? There's two in back. There's two bumps here. What do you suppose this one up here is called? I love what Miss Smith is. Yes.
Superior.
Yes.
Right.
Yes. Did you guys hear what she just said? She said the bump in back above the other bump on the iliac spine. So we actually have posterior, anterior iliac spine, posterior, inferior iliac. Posterior. Oh God. Okay. Anterior, superior iliac spine, anterior, inferior iliac spine, posterior, superior iliac spine, posterior, inferior iliac spine. You'll never feel this one, really. It's too buried. Why do I care about this one back here? These, you can feel these on people too. They're kind of the bumps by their sacrum. Well, what I like with this one is if I poke right inside it, what joint am I in? It lets me know where your sacroiliac joint is. I can find this on anybody, which is the posterior superior iliac spine, and I just go inside it, and I can actually work a little bit of that joint that bothers so many people. And then clients go, nobody's ever hit that like that, because nobody knows their anatomy good enough to find it. Right? I don't mean nobody. I know that sounded very arrogant, but it really is true. I've had a lot of people say that, and I'm like, it's not that hard if you know your anatomy a little bit. That's why you want to learn anatomy. You can find spots in people that other people can't find. Miss Smith, please.
Is that where like the dimples in the back are?
Yeah, you mean like the dimples by the sacrum? Yes.
Yeah, that's like where that dip is.
Yes, roughly.
Okay.
And the reason I say roughly is because people dimple slightly different depending on where their skin hooks to that area.
Okay.
But that is, yes, that is where those dimples are. Yes.
Okay.
Feel around that area, and you're trying to find a bone. What you do, what I do, I find the sacrum. Sacrum's really easy. You're finding a flat bone here. It doesn't look as ripply here, right? When you can kind of hit it on somebody, right? You hit it, I find it, I move out laterally until I catch this thing. And you'll catch this little bump, because it's covered with fascia, so it's a little bump, and that lets me know right where I am. But that will be roughly where those dimples are.
That's also like where you would start if you're doing like the lamina groove, like up the spine.
Yeah!
Is that where you would
Yeah,
start?
I never thought of it that way, but I love what you said. Yes, if I were to come up here, I'm almost in the lamina groove from there.
Okay.
You're right, going up the lamina groove. And you want to be in the lamina groove when you're going up. I mean, you want to also go out from the lamina groove, but inside the lamina groove is the rotatories, the multifidi, the spinalis, the longissimus. And sometimes people are massaging out here, which you should do that too. But if you never get in here, you're not getting into all this little stuff that gets sore. And by the way, that's little stuff that can pinch on these nerves. So yeah, well said.
I'm sorry, one more thing.
No, don't be sorry. This is very relevant.
Yeah, I just feel like a lot of people have pain in that area. And I have noticed, just on people that I massage, there's a lot of swelling a lot of times in that area.
Yeah.
Is that pretty common?
I haven't noticed the swelling. It doesn't mean that you're wrong, by the way, and I'm not trying to like make everybody right. I mean, you could be dead on right, Miss Smith, but you also could just be feeling the way people hold like fascia and fat on their body. Because it's also kind of an area where a lot of your fascia hooks around there so that your butt doesn't droop down to your ankles. And like, like it's a central point on your body. And so I could also see it feeling kind of puffy.
Okay.
So just, I don't know. I honestly don't know. That's more of what I've experienced.
That's just kind of like what it seems like, is like swelling.
Well, that's why I was like, you could be right. Yeah.
In that little,
It is definitely a high tension area that people love to have rubbed. And that most therapists don't get to. For one thing, it's way too close to the bottom or something, and people are just freaked out. And just kind of, I use the word, butt and bottom to kind of remind you guys where the gluteus maximus is, but I don't even think of that as a bottom. It's all hips to me. That's all it is. These are all hips. Yeah, the whole thing. Cool. Okay, let's look at some slides of the adductors, because now they're going to make perfect sense to you. And you're like, oh, it'll be great. Let us do that. Let me share my screen with you. Okay. So our opening picture is actually really useful because we can see the inside of this guy's thigh. And so it's actually not a perfect picture, but basically this back here would be the adductor magnus, and this would be like the adductor longus and brevis. And believe it or not, this really long one that goes across the knee is your gracilis. The gracilis is the one adductor muscle that crosses the knee. So in my mind, when I learn a group of muscles, I learn what's most important about them. And when it comes to the adductors, what's most important is to know the 5 names, right? Adductor magnus, adductor longus, adductor brevis, pectineus, and gracilis. It's important to remember the adductor magnus, even though it's between the legs in the medial compartment, it is the most posterior, and all the other ones are in front of it. It is so posterior it can act as a hamstring. That's very important to remember. The gracilis is also extremely important to remember because the gracilis comes down here and it hooks across the knee on the inside of your knee. It is meeting other muscles there, by the way. Just so you all know, the gracilis meets up with the semitendinosus, which is a hamstring muscle, and the sartorius, which is a muscle all by itself that probably haven't even learned about yet. That's over your quads. And all 3 of them triangulate and meet here on the inside of your knee. That means if somebody's having knee problems, strangely enough, looking at the sartorius and the gracilis and the semitendinosus is not a bad idea. But there's something else very important about these muscles meeting on the medial side of the knee. What are knees not good at? Yes, Mr. McClure does this kind of thing, right? They're not good at lateral movement. And so on the outside of your knees, you've got the iliotibial band, right? That big, thick thing of fascia runs across your knee and helps protect you from a lateral blowout. Super duper helpful. What protects you from a medial blowout? Wouldn't it be helpful if you had a muscle from the front of your leg, the middle of your leg, and the back of your leg that all met below your knee and helped protect your knee from medial blowout? And what if we call those muscles the sartorius, the gracilis, and the semitendinosus, and they all inserted into a place we call the pes anserinus, which stands for the goose's foot, which is the three-toed goose's foot. That helps protect from medial blowout and helps with knee alignment. The key about these, this is way over today's lecture, but it's really helpful for those of you that care. If the IT band on the lateral side, right, they're always on the lateral side, but the IT band on the lateral side or these three muscles on the medial side are too tight, they will pull the knee out of alignment. Now, knees don't like being out of alignment. Nothing likes being out of alignment, but especially knees. They need to do extensions and flexions only and do them very straight on. And if one side is tighter and it's kind of pulling it out of alignment, that you can get somebody who comes to you and goes, I just feel funky when I run right now. It's almost like my knee is not like in alignment. They'll tell you that. And then you notice that their inner thigh muscles are really tight and their sartorius is tight and their semitendinosus is tight. And you're like, oh my gosh, this person's got too much medial tension and it's pulling their knee out. Believe it or not, that actually pops your knee to the outside, having it tight on the inside. And having it tight on the outside pulls it to the inside. But anyway, and you rub it and they're like, wow, I went on my run and it's just like you fixed me. Because you allowed the knee to go back into a natural alignment. And that is a very good feeling. Right? Because we don't get a lot of that as massage therapists. We make a lot of people better, but we don't get kind of fixes in the traditional sense. And this is one of those things where you work on somebody like, yeah, it just feels like my knee. It's not clicking anymore. It's just running along. It's great. I don't know what you did. I paid attention to my anatomy. That's what I did. Let's move along. Let's take a look at this little guy. By the way, this is the sartorius coming from the anterior superior iliac spine, or the as-is, ASIS, and it's going down across here. It's going to go all the way down here and insert into the pes anserinus. It's going to meet the gracilis from here. You can't see it, but it meets it down here. Boom. In this picture, notice that you can see the pectineus, the adductor longus, the gracilis. You cannot see the adductor magnus. Why can you not see the adductor magnus in this picture? You're right, Miss Lewick.
Because it's posterior?
Because it's posterior, thank you. I just want to hammer that point in. I can't really rub it from the front. I can rub it from the middle of your leg or the back of your leg, but not from the front. Well done. Really well done. Here's the back of the leg. Here is the adductor magnus. I know this picture made it nice and different, but do you see much difference between it and the other hamstrings here? Absolutely not. These are all hamstrings here, and this is your adductor magnus here. The gracilis is running right down the outside of the leg. And it's coming down here across the knee to protect the inside of the knee. Very cool. So, this is a cutout like I just showed you with the model. This is a cutout as though you're looking at the inside of somebody's leg here. And here is, which muscle is this? Hold on. Yes, this is the sartorius here coming down here. Gracilis coming down here. And the semitendinosus, the hamstring. This shows you the pes anserinus. Pes anserinus means goose's foot. It is French for goose foot, a three-footed thing. And they mean that because when these three tendons come together, they make like a goose foot. It's not very obvious from this picture. I don't think it's obvious on a real body, but that's what they call it. It is a tendinous connection. If you rub below your knee, on your medial side of your tibia, you will feel a real flat spot. You won't feel much of anything, but it'll feel painful. And that is these three muscles coming together. It's under quite a bit of tension on people. So let's look at the adductors here. Head on, we've got the pectineus. It's the smallest one. It's very in front, so it can actually help with a flexion if it wants to. A little bit, by the way. It's not a major, but it could affect anterior tilt. What, Mr. Tapscott? I should rub the inside of the legs when somebody has anterior tilt too? Yes, you should. People rarely have a problem because of one muscle. So please don't leave this class and think like, oh, Mr. Tapscott said gluteus minimus causes anterior tilt to the hips. That's all I need to know. Well, so can the tensor fasciae lata, the rectus femoris, the pectineus, you know, the iliopsoas, like lots of stuff can. And I would look at all of them because in massage it doesn't hurt to rub extra stuff. Anyway, pectineus, adductor brevis, adductor longus, adductor magnus, gracilis. Nice picture. It's very hard to see the adductor magnus. It's kind of hiding behind the other ones. So, again, remember, by the way, because you guys had a funny homework assignment where a lot of people, we were asked about the deep six, and we said which one's most superior, and people said the gemellus superior. Which one's most inferior? You said the gemellus inferior, and it's wrong. All it means when you see stuff like that is they are the most superior or inferior or the biggest or the longest compared to other muscles with that name. So the adductor brevis is the shortest adductor muscle that has the word adductor in it. The adductor longus is the longest adductor muscle with the name adductor in it. The gracilis doesn't have the word adductor in it. It happens to be longer than all of them. The pectineus doesn't have the word adductor in it. It's shorter than all of them. Does that make sense? Okay. And by the way, when I'm rubbing these, in general, I'm not thinking to name all of them. But look how much space they take up. And look what we see about the femur here. I've said this to many of you. Does the femur run straight up and down? No, 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 no. It actually runs out laterally. Which is why when we rub up the lateral side of somebody's leg really hard, we tend to hurt it because we get flesh pinched in here. And then if we're really not paying attention, we run right over the greater trochanter too. And if we avoid that, we're not rubbing hard enough, which is why I like to rub down the outside of the leg. Anyway, on the inside of the leg, it's really good to rub up because I'm trying to get into all this. By the way, many massage therapists don't go up past here, which is nice. You got some attachments. I mean, you got 10, 15% of the muscle. That's enough. No, it's not enough. Drape high and tight. Use a forearm. It's not invasive when you use a forearm, and it's not pokey like fingers. Use a forearm, frog out their leg, and rub in there. Be gentle, by the way. The inside of legs are much more sensitive than the outside of legs. Inside of arms are more sensitive than outside of arms. But get up there. Ms. Cuppich, you raised your hand, lowered your hand. Raised it again.
The reason why
Laughed.
I was just going to ask you if the best way to do that is to frog out their leg.
It's a good way to do it. It really is. You frog out their leg. And I frog out their leg and I'll use my forearm because I find forearms are not very creepy.
And then if you're on the left leg, do you use your left arm? And if you're on the right leg,
Yes.
do you use your right arm?
That's how I do it. You don't have to, but that's how I would do it. You're absolutely right. On their left leg, I use my left arm, yes.
So you're facing their feet when you're doing that?
No, facing their head. I think you got yourself turned around. The client's left leg is by my left arm when I'm facing them. They're face up, by the way, right?
Yeah.
Supine on their spine.
Yeah.
Think about it.
Oh, wait. Left. Okay, not the opposite. Not left. Not right leg, left arm. You do right leg, right arm?
Yeah, because if I'm facing you, which arm is closest to you?
My right.
To which
If
leg?
you're what? If you're wait, what?
If you're on the table and
Yes.
you're looking up the ceiling,
Yes.
and I'm standing next to you
Yes.
on your right side,
Yes.
and I'm looking at you,
Yes.
And
You're on the right. It's right.
right to right, yeah.
Right to right.
Yeah. I'm just trying to answer your question, yeah.
Scott, you gave me a really good tip when I did your legs during
Oh, that's
clinical.
right. Yeah.
Yeah, always do the arm that the hand is away from the groin. So always have like the elbow should be closest to the groin area, like no matter what side you're on.
Yeah. If you use the left arm and the right leg, Miss Cuppage, my hand tends to be down in their groin. And I don't want to accidentally graze some. I just don't even want it to feel funky. And thank you, Miss Smith. By the way, Miss Smith did something really neat, everybody. When she wanted to work on me, and she chose to do what she's least good at. Right? I mean, that was the idea. I thought that was very impressive. She didn't say, let me, she said, let's look at what I'm not good at. And you were actually quite good at legs, by the way, Miss Smith. But the fact is, we looked at what she felt least confident in and worked on that and broke it down. It was really good. Yeah. Mr. Bigelow. Yes, sir.
I just had a question. Like you said, when you're working the leg, the lateral part of the thigh, you go down because of the femur goes to like a lateral angle.
Yeah.
And I know that a lot of therapists, they want to push up to the heart because of the lymph or whatnot. Is that an exception or?
Yeah, I wanted to be able to show you some stuff, so I took us off the thing. Here's the problem that you guys are going to have with everything we teach from here on out, basically. Everything you do, there's a trade-off for something else, and you have to decide the best trade-off, right? So I'm not a big believer that you should always be working towards the heart because I feel like everything's going back towards the heart eventually, right? So I don't worry about it, but some therapists do. In fact, there are some Canadian therapists that it's part of their license. Like they have to work towards the heart. And I don't think they're idiots. I mean, I see the real validity of that. I do try to work towards the heart, by the way, especially when I'm working your arm, because if you work away from the heart and squeeze off somebody's arm, you'll actually make their hand kind of swell up, right? You can pull so much blood down in there, you kind of make it swell up, it doesn't feel good. But I don't try to work towards or away from the heart only because I feel like I lose half my strokes. If I'm always working towards the heart, I have to go stroke, lift up, stroke, lift up. You know how you become twice as good a therapist at the same amount of time? Don't lift up. I'm now getting twice as much work done as this person. I think that the trade-off is worth it. And I figure I'm helping circulation either way. The heart's taking care of circulation. I'm cleaning out the pipes and the tissue. So that's me. When it comes to the femur is like this. It's going into the hip, and it actually, your knees kind of go in, believe it or not. And if I rub up on the outside, I do rub up, by the way. I rub both directions, but I rub light going up because I'm coming up to meet bone, and I don't want to hit it and pin. So I rub up light. I actually curve my hand out like this and scoop up, and then I cut in and go down hard. So I go up like this, because this is more gentle to come up like this, and then I cut in and come down hard. Or I go up with the nice fleshy part of my forearm, and I come down with my ulna. So, because here's the thing that you guys need to really, really, really think about with deep tissue. If you're doing it right, you're not hurting the client, but you're kind of taking them to the edge a little bit. And if you're not creating that sensation for somebody who likes deep stuff, you're like, oh, my technique works going up, you're probably not going deep enough. I mean, I can go up your leg with a forearm and not hurt you, but you'll also be like, but you're not getting anything done. So I'm trying to go as deep as humanly possible on you without hurting you. I had a really, really good student who said, she said, it's not how deep you go, it's how you go deep. But she's right. So I want to go deep on you, but I don't want you to feel beat up. I really don't. I don't think deep tissue is supposed to be like that. But I also think it's terrible when somebody thinks they're doing deep tissue and they're not really. So when I worked at the Princess, I would have you come in and do a practical. And this is a good test for all of you to do on yourselves if you ever want to. And I'd always ask people to do the deepest massage they could do. And I did that for two reasons. Two really good reasons. It's not because I thought they were going to do deep massages all day long. I did it for two reasons. If I have a stereo that I can crank up to number 10 on the stereo and it's crystal clear, is it going to be crystal clear on 2? If I have a stereo that's crystal clear on 2, is it going to be crystal clear on 10? You don't know. Speakers might start cracking. So if I've never met a great deep tissueist who couldn't tone it down. But a lot of us can't tone it up, right? That was the one reason I did it. I told the people coming in for an interview this too, by the way. I tell them right up front what they're up against. The second reason I ask them to do their deepest massage is because that's when the mistakes show up. And I don't care how good a massage therapist you are. I think I'm very good, but I make mistakes in deep tissue. And if you're not making mistakes in your therapeutic massage where you're like, oops, sorry, a little too deep there, you're not going deep enough. On somebody who likes deep work. So the deep work is when we see the mistakes show up. If you guys just do this, give me a practical and just do this, what kind of feedback am I going to give you? I don't even know if you know your anatomy. You just went like this all over my body. That's great. But it's when you're in deep that I'm like, oh, you didn't notice that bone, did you? You popped over it. You didn't notice this thing. And that's when we can start to really kind of work on stuff. Miss Cuppage, yes.
So I'm just going to give a shout out to Mr. Shockley because when he does legs and glutes, like everything that he does is like multi-tools, multi-pace, and then it gets everything. It's both directions. It's all directions. It's like, it totally, like when he massages, he totally does like your entire leg, or whatever he's doing. And it feels really good just because it's not the same pace or the same stroke or the same tool.
And he gets the whole leg too?
Yeah, he does really.
Does it feel invasive?
Not at all.
No. Surprisingly enough, when you're doing therapeutic work, it doesn't feel invasive. When you're doing this, by the way, this feels invasive.
Yeah.
It really does. When you're going to town on somebody, like, oh, wow, okay, we're working the legs today. Okay, that's what we're doing. Yeah, that's fantastic to hear. I have rumor on the street I've heard from other people about his massage, too, so I'm not surprised. But that's fantastic to hear. And, yes, that is the one thing I will say about legs is they do get irritated. So when I rub somebody's inner thigh, I rub it for a second, then I rub the outer thigh. Then I come back to the inner thigh. Then I come back, because otherwise it gets very irritating.
Just irritating instead of being therapeutic.
But you fix that by just moving around and coming back to it and changing your techniques and stuff. I love that. Thank you. Shout out to Mr. Shockley. All right. Boom. Mr. Kajekian, sir.
I just thought of something that would be my mantra in my head. Like, I don't know if this is right or not, but I was thinking to myself, if you're not like kind of coming into contact with the muscle, not like pushing into it or anything, but like rubbing the muscle, you're not going deep enough.
Yes. So
I don't know if that's even close. But
well,
that's
Tap Scott likes that mantra. I say if you're not feeling texture, you're probably not going deep enough. And it depends. I mean, I've had clients that want to be tickled, and I don't mind tickling people for $100 an hour. That's okay. And I don't mean that sarcastically. I really mean that. But what I do when I ask you about do you want more or less pressure, I'm actually not thinking about how hard I'm pushing on you. Right? Because I hope that you guys don't say, oh, he wants 35 pounds of pressure. I will therefore use 35 pounds of pressure everywhere on his body, including his eyeballs. Right? Because the person that can take 100 pounds of pressure on their back only wants 35 pounds of pressure on their inner thigh. And maybe 45 on their outer thigh. And maybe you have to guess a little bit. So, and I don't know what 45 pounds of pressure, I'm just trying to make a point. What I do is I say, oh, they like this level of texture. So for some people, the texture I get is just kind of like, just that little bit of muscle graze where I feel that bump, 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 right? Then there's people who like psycho deep tissue. What I feel is that you almost feel like the fascia splitting, not hitting bone, but you feel like, and I go for that sensation everywhere I go. I don't have to go very deep on this part of the forearm to get that sensation. I have to go deeper on the glutes to get it. And that's what I keep in mind. I'm not actually thinking about how hard I'm pushing. I'm thinking, what's the level of grain that I want to feel? Grain. Some people almost no grain. Totally cool. Other people, grain until I'm just about grazing bone. And it's almost like a sound to me. It really helps me. And that way I can guess your whole body pretty good. Pretty good. Mr. Bigelow.
Yeah, speaking about pressure too, I just kind of wanted your advice. I mean, I know, checking in with pressure is good, but I think therapists can also start to annoy the client And also you kind of, I feel that you have to kind of have some sort of a gauge, because like you can go really deep on the back, but in the medial thigh, in the inner thigh, you're not going to go the same pressure. But it doesn't make sense to check every body part either. So you kind of have to make an educated guess of how much pressure each body part is going to take. Am I not wrong or right? Or
I think you're 100% right. So,
but
and again, it's a trade-off. It's a trade-off, right? You're taking a risk. But if I
also
yeah, go ahead.
Also, I'm sorry. Go ahead.
No, you go ahead.
I was just going to say, because I put myself, when I'm giving a massage, I try to keep when I'm giving a massage, I try to keep in my mind what would I like and the different strokes. And, I don't like to be asked a million times during the massage about the pressure, you know what I mean, on every single body part. So we kind of have to be smart about different areas and how deep we can go and, get a feel for the client.
Yeah. And I couldn't agree more. And I know that I keep running the pressure thing in the ground, but I always say pressure is to massage like spices to a dish. Right? And if you guys go for Thai food and it's got no spice in it and you like spicy Thai food, it kind of ruins the meal even if it's nice. But you don't want to pay a lot of money for just nice food. This is $100 an hour food. You want it to be great. So I really think it's important to get it right. What I do is I usually ask, Mr. Bigelow, based on what I've done so far, do you want more or less pressure? Well, maybe a little bit more. He does. He's just being nice. Okay, Mr. Bigelow. And then I give him more. Don't ask the question if you're not going to give him more. That's really annoying too. Give him more. Mr. Bigelow, do you want more or less pressure? Well, maybe a little bit. Okay, Mr. Bigelow. Mr. Bigelow, do you want more or less pressure? I think that's about right. Sometimes I'll even ask this question. If I tend to err, Mr. Bigelow, should I err by going too deep or too light? And he'll be like, actually, I'd rather you hurt me than not hurt me. I like it deep. Or no, definitely not more than that. Okay. I'll never ask again for the rest of the massage. And what I do is I pretend like every body part of his is my body part. I do that for two reasons. It builds empathy, because I think you can actually feel what other people feel. And so I pretend it's my leg, not my pressure preference, my leg. But I remember, oh, my leg, if you were rubbing it this hard on the outside, when I got to this part, I'd want you to tone down to this, right? Oh, my back would be able to take this, but bottom of my foot, maybe this. And I found that works pretty darn well for most people. And then if they jump or they say something, whatever. Yeah.
Thank you very much.
And last thing I would say too is, I would rather, as long as I'm not bruising somebody, I'd rather go too deep than too light, because people will usually speak up when you're going too deep. If you're going too light, and I will say this 100 times, it breaks my heart, because it happens to people. They don't tell you anything, and they just don't come back. I want to know. And I've never had a client get mad at me for hurting them. They go, oh, wow, well, that's a bit much. Oh, I'm so sorry. You know me, I just get overzealous. Back off. But they're like, but you're working, right? But if it's too light, I've had these massages before. I just lay there and think, oh, and I feel bad. I don't want to say it. So I just leave, and they just don't come back. Except that you guys get paid per massage, so that's the problem. Yeah. And by the way, it's not so bad. They won't just not come back. They'll also make sure to tell their friends, when you go to that location, don't ask for so-and-so. They don't do any pressure. Mr. McClure.
To Mr. Bigelow's point, I was massaging my friend the other day, and I was very talkative because I just had my coffee. I was excited to be there because I was a new client, so I kind of get into thought and theory and all that, and I was annoying her because she was falling back to sleep, and I kept waking her up just by having excited thoughts. And I think it hit me at the end when I was doing her neck and shoulders. And I just said out loud, I cussed. I'm not going to say it here, but I was like, I need to stop talking about myself. This isn't about me. This is about you. I'm sorry. I'll shut up.
Been there, done that. Thank you for being so honest. And you connect
I'm
with your
glad
client.
I clicked this early on in my career.
Well, you'll probably do it again just because you get kind of, you start chatting with somebody. It's kind of fun. But I have found a lot of clients chat the first 10 minutes or so, and they want to stop then. And so I do a little trick with myself, because it's very hard to tell when somebody's being polite. If they're carrying the conversation or if you are, I let the conversation drop a few times during the massage, even if they're chatty, and see if they start it up again.
Yeah, because talking to people are going to talk,
Yes.
even if you're listening or not.
And then, see, you just started the conversation again. So now I can talk
Yeah.
for a little while longer, and I go, yeah, that's really cool. And then I let it drop again.
Hey,
Oh, thank you. So, and then I start up again. But I literally do that because I've had a lot of clients come out at the Princess and say, the therapist talked to me the whole time. The therapist says, but they talked to me, and the client's like, I was just being polite.
Yeah.
I wanted to rest at some point. And it comes at any time. Sometimes it's the last 10 minutes of massage. So I drop it every so often because I'm that guy. I'm worse than you, Mr. McClure. I'm like, oh, we're connecting. Da, 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 da. We are,
Yeah.
but it's their time. They're paying me. I'm not paying them. You know, it's hard. And by the way, again, they're naked. What are they going to say? Shut up? Like, you know, the power differential we forget, and they want to be polite, you know?
Yeah. So on deep work, what's your medium? Do you use butter, oil, gel,
Spit.
lotion?
Come in there.
Spit.
Sand. Sand.
Spit shine.
I don't care too much. I think gel and creams work better. But I think the real key is just not to use a lot of anything.
Okay.
So
I like that biotone stuff, but it gets really greasy.
Yeah.
Pretty quickly.
I have found something I love. I just like to have one ingredient in the classroom. Maybe we'll switch someday. I also found as a massage therapist, I'd get tired of everything I used. Like when you do like 6 months of massage with whatever, you're like, you just want something new on your hands. But the real key is don't use a lot. I'm just trying to avoid pulling your hair and pulling your skin. I'd like to stretch your skin. I just don't want to annoyingly pull it.
I've been trying to use less, and I feel like I'm doing a little too much friction.
Yeah.
So it always...
Yeah. I also, by the way, speaking again, I use more oil on your inner thigh than on your outer thigh. Because the skin on your inner thigh is thin and it does not feel good being pulled that way, right? On your outer thigh, it's not so bad. So I kind of remember that kind of stuff too, you know? That's a good trick for me. Miss Magruder.
Yes. Or was you still going to each campus to demo the whatever
Yes.
said
I was just talking to, I'm just trying to find it in my calendar, but yes, it's coming. Coming soon. To a theater near you.
I can't wait.
Good. I like that.
Oops, sorry.
Oh, I was like, follow-up question?
That was good. Thank you.
All right, let's finish going through these things, guys, and I will get your homework out to you, too. You do not have a lot of homework. Because Ms. Cuppage called me before this lecture and said, don't nobody.
Mr. Prescott, I have one question.
Yes, ma'am, I'm sorry. What is it?
I remember you were talking about draping higher. When men have on boxer and their boxers, how do we handle that as a female?
I as a female or a male, I drape high and tight, and I say, do you mind if I scrunch these up? And they're always like, yeah. And I just kind of take their shorts and kind of pull them up a little bit. The problem is that's the style of our underwear these days, you know. So, but yeah, and it doesn't seem to be a problem, you know. Sometimes guys, by the way, a lot of guys wear long shorts even, not just their underwear, long shorts in massage. They're trying to be respectful. And
I know that in clinical.
Yeah, and it's like, I really appreciate you being so respectful, but I actually wish you were wearing less. But I don't tell them that. I just like, do you mind if I hike this up? And they're like, oh yeah, I don't care. They don't know what to do. Yeah.
Thank you.
Yeah. You're welcome. Okay. Alrighty. Where were we? Let's take a look at these beautiful muscles that we were just looking at. They're coming back. Adductors. You know what's amazing is that your brain, each of these adductor muscles and all the muscles all over your whole body are made by all these fibers, right? These muscular fibers that are attached to nerves. And your brain has to decide how many of those nerves to fire, how long to fire them, to create perfect balance and movement in your body. That means it takes millions of signals to get you to raise your arm in some kind of nice, fashion, let alone dance. It's just unbelievable. Okay, so we see the adductors here, and we see from the inside of the leg the adductor, gracilis coming across the knee. Because Mr. Tapscott is really trying to emphasize that that is the one adductor muscle that crosses over the knee and could actually cause problems with knee alignment. The other muscles don't cross over the knee, but this adductor magnus that's way back here is so far back it could act like a hamstring. And they all help to get you up out of a squat and pull your legs together. And they make up a lot of the size of your leg if you think about it. A lot of the size of this leg. Look at this, how much muscle is on the inside of your leg. You don't think about it because you see your leg as a total unit. But they actually make up a lot of the size of your leg. Okay. So, luckily for you guys, when we used to teach anatomy, we'd have you literally memorize every last little thing. Like the fact that the pectineus attaches to the superior ramus of the pubis and hooks into a line in the back of your leg called the pectineal line. And we go through all that with you. It's not as important, to be honest with you. What is important is that you remember that these smaller muscles are kind of hooked up in front, and the adductor magnus is in back, and it's hooked to the ischium. And these other muscles in general are hooked to the pubis. So I just want you to kind of remember how they stack up on the legs, and then they all hook up going down the leg here as we go down. Let's see if they have the magnus in here. The magnus is huge. Here's a picture of just the magnus. Actually looks like a whole bunch of muscles together, but it's not. Notice that it's grabbing on to the ischium back here, the ischial tuberosity, where your hamstrings hook. So it shares an attachment with your hamstrings. By the way, this is not important for your daily massage stuff, but it's an important anatomy fact to kind of know. Hiatus. Have you ever heard people tell you they're going to go on hiatus? They're going to go on vacation. I'm going on hiatus. This is called the adductor hiatus. It's where your adductor your adductor magnus went on vacation. It really is a hole in your adductor magnus, and the hole is there for veins and arteries and nerves to go through. You need a pathway from the front of your leg to the back to your front. So if you open somebody up, it wouldn't be a clear hole. It's covered with stuff, but the point is it's a passageway through. Doesn't matter to your massage, and you're not going to feel it. I'm just explaining that.
Is that a danger zone?
No, it's not really. No, I know what you're thinking, but it's not. It's deep in there. You're fine. It's a really good question, though. And I honestly only think about it when I'm teaching lecture about this stuff. Then the only stuff I really think about is just how big the adductor magnus is, that I can rub it from the backside and the middle, that it acts like a hamstring, that it's your most powerful adductor, that it hooks right down here above the knee. Doesn't help with knee stability in general. What, by the way, can all of these adductors do because they're between the leg if they work unilaterally? And this probably isn't even in your book. If the adductors work unilaterally, let's say all 5 are tight on just one side, what can happen? Yes, Miss Wick. You're muted, ma'am. Still muted. Miss Swick. You're muted? Can't hear you?
I think you muted her.
I think he did too. It's very likely he did that.
No. I wish I could do that.
You made me lose my train of thought.
It's alright.
Anyway, so if only one side is moving.
Only one side is tight.
If one side is tight, that could cause knee pain on the lateral side. But
yes, it could. That's a good point too. That gracilis. Well, what can it do to your hips?
It causes the lateral tilt.
Mm-hmm. She's right. So if one side is tight, it's pulling my leg in. Well, I'll show you guys in a second, but it's pulling my leg in on just one side. It could actually cause lateral tilt, which is not a pretty thing. So that's another thing that could cause lateral tilt.
I was going to say that you kind of would walk with a limp.
Yeah, you would. And you walk with a limp when you have lateral tilt. Does that make sense?
Yeah, I'm just like, when we talk about like the visual assessment part, like if somebody's walking with a limp, that it could be that too.
Yeah. So let me take us off this for a second. So let me ask you this. I don't know which is my right to you guys, but this is my right over here. If my right hip is elevated, which side of my adductors is probably tight and which side of my gluteus medius is possibly tight?
Left side.
Both?
Left adductors, right. I'm trying to picture you. My left adductors, and then the right medius.
So
I think it'd be both sides.
opposite.
What?
Both sides are tight. Or no, not both sides. The same side is tight for both muscles. So if your right is tight, your left.
So let's talk about this.
Is the way they're attached. It pull down either way.
Let's
It'd
talk
be
about
the
this.
right adductors, because the adductors would be shortened,
All right.
and then the medius would be shortened.
Right. So let's talk about this. Let's take this right here. This is a fake femur going in here, right, into my acetabulum here. This is my acetabular femoral joint. The gluteus medius is here. If it's tight, I'm going to bend this way, right? To bend this way, by the way, what muscle has to lengthen? The adductors on the same side have to lengthen. I know it doesn't seem that way, Miss Smith, and by the way, I appreciate your facial expressions because it makes me a better teacher. I really mean that. But if you think about it, going this way is the same as this leg going out this way. When this hip goes over like this, it's the same. Look at this. Look at this. What does this look like? Oh, my leg out to the side looks the same as my hip over to the side. I didn't move the acetabular femoral joint. So this is the gluteus medius on this side, the same side, that's tight. What do the adductors do? They pull that leg back in. So what really happens is the gluteus medius on one side is tight and the adductors on this side are tight. On the opposite side. And if it hurts your head, that's good. It means you have a fairly good understanding of what we're talking about, even if you don't have it exactly in your head. This is the type of stuff we want to think about, because you will have somebody come in with a tilted hip, and you don't think about the adductors as pulling the hip over that way, but what happens is it's pulling this leg in so much, it's pulling the hip over, and this could be the gluteus medius pulling you over that way.
So you're saying they're both tight?
Oh yes, I'm saying that there is a gluteus medius on one side tight and adductors on the other side tight. I'm trying to get you to put a whole bunch of kinesiology together now.
If they're both tight on one side, then you just fall over to that side.
If they're both tight on one side, they actually, if they're both tight, if they're both tight on one side, one's an adductor and one's an abductor, so they just fight each other. So your gluteus medius can argue with your adductors on the same side. Because they do opposite things.
That's true, because the medius would be pulling this way, the abductor would be pulling. I got it.
Right.
Wouldn't that be normal physiology?
Yes.
Standard.
Yeah. In fact, by the way, when I stand here on one leg in front of you guys and try to balance myself, that's what's happening. My gluteus medius is holding me here. My adductors on this side are kind of fighting to hold me rigid. I don't want to lose. I want them to fight. I'm telling them to fight. If one wins, I go this way. If the other one wins, I go this way.
So, I just wanted to test you guys.
So the thing is, you have to understand that, I know it sounds weird, but actually, for those of you who are still thinking about this, here's my gluteus medius tightened up. Okay? My adductors on the same side are actually lengthening. These adductors, if they tighten, they're going to add my leg back in. So my adductors are tight here, and my gluteus medius is tight over here.
You just said, though, that the ones that are, the medius is tight, and so are the adductors on that same leg. They're being stretched. So that's tight if they're stretching.
No. So I understand what you're saying, though, by the way. That actually really helped me. Yes, it feels like things are tight when you're stretching. Maybe I shouldn't use the word... I should use the word short or long. When I mean tight, I mean shortened. So, contracted. When my gluteus medius contracts and shortens, it pulls me over like this. if my adductors contract and shorten on this opposite leg, it pulls this leg back in. Not that gravity wouldn't do that on its own, it would. By the way, I don't want to confuse you even more. We don't know this is happening with everybody who's walking around with a tilt of their pelvis. This is just some good stuff to look at, right? Everybody's different. So I'm so sorry. But when you're stretching, you feel tightness, but you're actually long, right? You're lengthening. So I apologize for using tight. It's just something clients use. Shortened, contracted, that kind of tight. Yeah. Bad teacher. Good student. Yeah.
No, not really, because like you said earlier, when the muscle tightens, it can only pull, right?
Yes.
And
exactly.
so that means it shortens when it's contracting and it's pulling.
Yeah. And it is language that clients use, and so we kind of need to mix it in. But it is confusing. When the book even uses it and I read it, I'm like, is it lengthened because of this or that? Or, it's confusing. Yeah. Cool. Mr. Kachekian, yes, sir.
So I don't want to make things more complicated, but when you're flexing, you're making the muscle longer, right? And you're extending, you make it shorter.
Well, so here's the problem. Flexing and flexion are not the same thing.
Okay, so I was mixing that up, sorry.
Yes. So I am doing a flexion of my elbow by flexing my bicep. We don't even really use the word flexing in kinesiology. That's just from bodybuilding. You've just been watching too much Pumping Iron with Arnold. It's funny, I saw, this has nothing to do with anything, but I thought it was really interesting. I saw an interview of Arnold Schwarzenegger, 40 years ago, and he's like, he won Mr. Olympia, and they said, what are you going to do next? And he's like, I'll probably star in a couple of movies and then maybe run for political office. And it's like, no, there's just no way. No, and he did all that. It's so weird. Miss Langford, yes, ma'am.
Yes, Mr. Toscott, I'm so confused.
Me too.
So if you have tight right, so if the adductors on the right side is tight, does that cause a unilateral tilt on the right or on the left?
So let's do it, because I get confused too. And you're talking about the adductors, the muscles between your legs.
Adductors,
Okay.
yeah.
So this is it doesn't matter, but this is my right side. And if these muscles tighten up, they're going to pull my leg in extra tight. And so it seems to elevate this hip. Now, I didn't memorize that. I just did it on myself.
Okay, so it's on the same side then?
Yes. Yes, they elevate to the same side.
Got it.
Yeah. I knew it. I could see you up there messing around, Mrs. Wick, and I knew it. What?
Okay, so if you pull your leg in, you can't see my legs. Hang on.
It's all right.
Okay.
I've seen them before. I know you've got them.
If you pull it so far over that it crosses your midline, that hip sinks. That one would go down. And the other side would go up.
Don't cross your midline. Put your legs together and flex only one side of your adductors.
I don't know how to do that.
I know. It takes extreme control. I'm a master. But
I can only flex one side if I'm crossing the midline.
Yeah.
That makes that
What
side
happens actually is it kind of almost lifts this leg up as you pull it in.
But if you're lifting that hip up to pull it in, I'm using this to lift my hip up to move it, not my adductors.
Well, let me ask you this. If you stand on one leg and move your hip the other way, if you de-elevate if you depress this hip, am I using adductors to do that? Any of them?
No, you're using
Right.
your abductors.
Right. You're not using any adductor to do that, huh? So if you didn't have gravity, how would you get back down?
Lean over to the other side.
Right, with your adductors.
Uncontract my glute.
That's with gravity.
Medius.
That's with gravity. If you didn't have gravity, you'd do the other side. Your adductors.
If I didn't have gravity?
Mm-hmm.
Okay.
How do you get out of an abduction without gravity?
You adduct?
That's right. And you would use your adductors to do that. So if just by what you just taught us, if this kind of depresses this hip and lifts the other one up with my abductor, then doing the opposite will do the opposite, which is my adductors.
We're going to have a talk in lab.
Mm-hmm. Yeah. Mm-hmm. All right. Let's take one last look, and then I really am going to do what I said I was going to do. I can't wait, Miss Swink. So I'm going to show you one last little picture because I think it's super helpful. It shows you all the attachments to these muscles, right? Again, you don't have to memorize all these, but notice the furthest one in back, adductor magnus, right? All the other stuff is kind of in front of the adductor magnus, these attachments. That's all I want to show you. Here's somebody with their leg frogged out. Do you see this hand here? Kind of touching up here by the hip? Do we all see that right by the person's shorts? I would never do that in a million years. Those fingers would feel pokey. I think that would feel creepy. And I work people up really high. I'm not afraid of doing that. But I would be using a forearm up here. And I'd be using this hand over here as the forearm. Yeah, as Ms. Smith pointed out to us, to keep my hand way away from their groin. It just feels less creepy. Nobody wants to be poked in their groin. You know, it's just not a place to poke people, period. It's just a weird thing. And I know the book's not trying to show you that, but I'm just trying to say I would. But I would work this high up. I work this high up with my forearm all the time. All the time. I'd do it to any of you. Wouldn't think twice. You know? Probably not in a 1 hour because I don't have a lot of time. I'm doing something quicker then. But I might. Definitely in a 2 hour. If you came in for hip work, we would go to town on this all day long. They're all wrapped up here with the sheet. They're all protected. They got a forearm going straight across this leg here. It feels great. Get some work done. It's wonderful. It's a good day. And that, I think that's it. That's it. Boom. Yeah. So, you know I'm going to recommend that you work on, I'm not going to make you. It's too hard. But I'm going to recommend you work on adductors. They're fun. They're fun, and it's another thing that other massage therapists are scared to do and don't do. And people like when you do it well. But the key with this is don't be pokey. Think big rolling pin. Big rolling pin. Yeah? And you tend to go lighter as you get down towards the knee because there's less adductor there. There's more adductors. You can actually go deeper as you go towards their groin, strangely enough. There's more adductor there. By deeper, I just mean this big rolling pin. I am never using like fingers and poking into their adductors or trying to strip their adductors. You know what I mean? I'm just trying to open them up. Yeah? Yeah. Okay. Questions or anything before what I'll do is I'll release homework and you can, you know, work on that. Questions, comments, thoughts, anything? All right, hold on. Let my computer wake up. While it's doing that, I will answer. Mr. Bigelow, talk to me.
I just had a question on, we were talking to, I think it was Miss Bauer in lab last week or something. And I was just wondering, are you going to try to take us to a cadaver lab or no?
No, I actually am going to try.
Okay. So that would be pretty interesting to see this stuff in real life. I mean, on a real person.
No, I couldn't agree more because the book makes it look all clean and two-dimensional too, and it's very different. When you see an actual cadaver, you're like, oh, the fascia's all kind of stuck to other stuff, and it's all, yeah. That's assuming that the cadaver is it depends on the level of dissection they've done and things like that. There's some things that are out of our control. But anyway, yes, sir, it's one of the things I'm going to work on. Yep, it's funny you say that because I was just looking at that last week.
Thank you.
No, thank you. And if any of you get a chance to go to, what is it called, that where they plasticize the bodies? What is it, the world of, what's it called? Somebody here has to have seen it. You've seen pictures of it, I guarantee you.
I've been. It's really cool.
It's very cool. But even
The
that,
plastification.
yeah,
The
I don't know how they do it.
plastification.
It's amazing.
The bodyworks.
Bodyworks, thank you. By the way, all of you only have 2 pieces of homework. You've got a 23-question test on the adductors, and you've got a chapter 14 clinical massage, chapter question thing, 5-point thing. That's it. 2 things. And I will see you all in about 20 minutes.